Hi everyone, in this video we're going to take a deep dive into looking at the abstract station for the UK Dermatology Interview. My name is Chris and I am a dermatology trainee currently based in the west of Scotland in the UK. I did my dermatology interview about a year ago and managed to score full marks for the abstract station, allowing me to get my top choice in the application. I know that some of you have come up to me either in person or online asking me to make a video on abstract station, and so I hope that this video will be useful when it comes to your application for dermatology interviews. The interview for dermatology specialty application consists of three main stations. You've got the clinical station, abstract, as well as the portfolio. Now, by far, most people struggle with the abstract stations the most just because we don't have much experience reading journals and interpreting them. For the abstract station, you get approximately 5 minutes to read the abstract without the conclusion, and then subsequently another 5 minutes to present any interpretation and summary of the abstract. The interviewers may then ask you some questions related to the abstract, as well as any other questions related to research in general. Hopefully by the end of this video, we will be able to critically appraise any generic abstract in 3 simple steps. Step 1. Summarize the abstract. You need to ask yourself a few questions. Number 1, who wrote this paper? What institution or country are they from? And where is this published? Which journal and which year? What type of study is this? Is this a randomized controlled trial, a cohort study, or even a systematic review? Who funded this project? Is this funded by a drug company where there is a risk of publication bias, potentially? Or is this funded by a charity or independent research organization? What is the aim, methodology, and results of the study? And most importantly, what is the conclusion of the study? Now, if you're able to explain the paper's findings to a non-medical person in layman's terms, it means that you are able to fully comprehend the paper. Step 2, critical appraisal. After you've understood what this paper is about, you then go a bit deeper into interpreting and critically appraising it. I've split this into 2 main parts. Part 1, methodology of the study, and part 2, the results of the study. In terms of the methodology of the study, you want to ask yourself, is this a clearly defined research question? Is this research question even needed in the first instance? Next, is this an appropriate study design? Now, different study designs have different strengths and weaknesses, and so it's important for you to find out if the authors have chosen the right study type. How were the participants allocated? Were they randomly assigned to different treatment groups? And how were they randomized? Was it done through a centralized computer system, or was it done by an independent person such as someone working in the hospital's pharmacy? And this is very important as it will have implications on the accuracy of the data collected. Also, was there any blinding for the participants, clinicians, and even the investigators? If not, this can lead to potential bias as well. Now, you may hear of this term called stratified randomization. This means that roughly equal numbers of participants with a particular characteristic are allocated to each treatment group. Now, this is quite important as it helps to reduce any imbalance between the treatment groups for known factors that can help influence or change the prognosis or treatment outcomes. This is especially needed if the sample sizes are small in order to minimize any type 1 error. Were the groups similar at the start of the study, and were they treated equally throughout the whole study period? Now, this will be reported in the study methodology section, but oftentimes you won't be able to get the information simply by reading the abstract. So instead of criticizing the paper, you may want to go something with the lines of, I would like to find out if patients' demographics at the start of the study were similar, and if the patients were treated equally except for the study intervention throughout the study period. Besides this, you would also want to know about patients' follow-up. Were all patients followed up appropriately? If not, how was the missing data handled? Generally, by rule of thumb, trials with more than 20% missing data is a red flag and should be highlighted and looked into. The sample size is also very important, and generally speaking, the larger the sample size, the more accurate the results would be. You also need to consider potential bias and confounding factors which can influence the outcome of the study. And I can touch more on this in later videos. In terms of the study results, you want to ask yourself this. Were all results clearly stated by the authors? Were all outcomes considered by the authors? You might also want to consider other outcomes such as adverse events, patient's quality of life, and specific outcomes that are targeted to the skin condition you are dealing with. For example, we use PASI as an objective assessment of the severity of psoriasis. We also use things like SCORAD and EASY to assess atopic eczema. We use other scoring tools like Sartorius, Hurley Stage, and HS clinical response tools to assess the severity of hidradenitis suppurativa. Other tools we can employ to determine the impact on patients' quality of life would include things like DLQI, POEM for atopic eczema, and itch numeric rating for itch. You might also want to check how the data was analyzed. Was it intention to treat analysis or per protocol analysis? Intention to treat analysis means that the data is analyzed according to the groups in which the participants are initially allocated to. This means that participants who drop out prematurely or who are non-compliant to treatment are also included in a primary analysis in intention to treat. Per protocol analysis aims to identify the treatment effect in optimal conditions. This means that you only analyze data from patients who have completed the treatment trial and exclude patients who did not. Now, both analyses have their advantages and disadvantages, and so it'll be quite useful to show to the interviewers what you know by highlighting the strengths or weaknesses the analysis that the authors chose to do. For example, in a superiority RCT, it is more favorable for us to use an intention to treat analysis as it shows a more conservative treatment response. However, in an equivalence or non-inferiority study, both intention to treat and per protocol analysis should be done concurrently to show if the results they produce are similar. Lastly, you may also want to consider if the results highlighted by the authors are statistically significant. And this means typically to be p-value less than 0.05, or if the confidence interval does not include 1. After appraising the abstract, you can take this one step further to see if the results highlighted by the authors are generalizable to your local practice. And typically we look at a few factors in order to help make our own clinical judgment. Number one, is this a multi-center or single-center study? How large is the sample size? And generally speaking, the larger the sample size, the more generalizable the results are to our local population. Number two, are the participants' demographics similar to the patient group you are treating? And again, this might not be found in the abstract, but it would be quite useful if you mention this to the interviewers when you are presenting. Next, you might want to ask yourself, are these treatments already available in the local setting? Is this a well-powered study? Oftentimes, there is no power calculated either in the abstract or in the study itself. In that case, you may then wish to look at the confidence interval. And so if you have a narrow confidence interval, you can kind of assume that this would be a well-powered study. Lastly, consider the costs associated with the treatments and see if they are cost-effective where you work. Also think about the effectiveness of the medications. A lot of the medications in research trials are compared against placebos. And so it would be quite interesting to know how they would compare with existing treatments on the market. There you go. These are my 3 simple steps that you can take in order to critically appraise any abstract for the abstract station. There are, of course, a lot more we can cover, such as statistical concepts, as well as specific examples to each of the study types. I can do that in the next few videos if you would like. If you find this useful, please hit the thumbs up button and subscribe to my channel, as it will mean a lot to me. Please also provide any suggestions as to what you think you might want to see next time. Thank you for watching once again, and see you again. Bye!